Good morning, everyone. Again, I am back this time, but this time we're going to talk about gastroschisis. Now, this is again an important exam topic, a condition that repeatedly comes up in your MRCOG Part 3 exams, where you have to explain this diagnosis to the patient in simple language and also be able to answer some follow-up questions from the patient. So, the patient would most likely be interested in the diagnosis, they may have done some reading, and they would like to know about follow-up and what to do next, and so forth. So let's get started. So we'll talk about how to explain the diagnosis. We'll talk about what causes it, what options the patient's got, what sort of treatments are available, and this is the kind of information that you will need to give out in your scenario of the exam so that the patient has got a good understanding of this condition when they leave the consultation with you. So, gastroschisis is where the baby's tummy wall does not develop properly. So, the baby's intestines normally would develop inside the baby's umbilical cord, and then as the pregnancy advances, the intestines would move inside the baby's tummy. In gastroschisis, the belly button doesn't develop properly, which means the intestines are left on the outside of the body, floating in the fluid that surrounds the baby. This can make the intestines quite swelled up and also quite thick because they're not meant to be in all that fluid floating outside. In terms of causes, we don't know exactly what the causes are, but we do know that we are seeing more of it, especially in mums under the age of 20. It happens in 5 babies out of every 10,000 babies. We normally pick this up at a 20-week scan, but sometimes it can also be diagnosed earlier around the 12 weeks scan. In terms of follow-up and appointments, the mother will usually be referred to a hospital, to a fetal medicine specialist who will rescan the baby and then get other specialties like the neonatologist and the pediatric surgeons involved. The good news is it's treatable. So gastroschisis is divided into simple and complex. Simple means that, which is 90% of the cases, it's easily treatable with surgery as soon as baby is born, and this does not have any long-term consequences on the baby's health. However, in the complex cases, especially where some of these intestines have been blocked, they can be although surgery can still be carried out, but it might be complicated and the baby may need to stay longer in the hospital and may also have problems with feeding and absorption in the future. So, in terms of what steps and choices the mother has, so the mother can carry on with the pregnancy, or she can decide to terminate the pregnancy. Now, this is something she can discuss more in detail when she goes to visit the fetal medicine specialist, especially after having discussed with her partner, with her family, if she wishes to do so, and then she'll be guided for the next steps. In terms of future pregnancies, this condition does not affect future pregnancies, so the patient should be reassured about that. Okay, so that is all about gastroschisis, which I think you should know for your MRCOG Part 3 exams. I hope I've been able to talk about this in quite simple terminology so that you guys can take this on board and be able to explain to your patient in the exam what this condition exactly is, and also what sort of treatment options and things there are available. Um, if you like this video, then don't forget to give it a thumbs up and subscribe to my channel if you haven't already, and comment below if there's any other conditions that you'd like me to cover, because there are so many more that I would like to talk about, which again are all part of important topics that come up in terms of fetal medicine topics for the exam.